This is our last chapter for microbiology, chapter 26, Nervous System Infections. This is an image from your textbook that shows the central nervous system, which includes the brain, the spinal cord, and your peripheral nervous system. What it doesn't show, which is very important to the nervous system, is the blood-brain barrier. Now, our blood-brain barrier is protective for us in most cases. It can prevent the entrance of many microorganisms, but it also has the ability to prevent medications from entering into our brain when we may need it the most. So sometimes it's important to understand that we do have this blood-brain barrier that can help protect us, but we also need to remember that sometimes if a microorganism is able to get into the brain, that sometimes that blood-brain barrier may keep out the medications that we may need for treatment as well. Portals of entry for these microorganisms include skull or vertebral fractures. That's the most common reason for a microbe being able to enter and get past that blood-brain barrier. It's often due to trauma that may occur. Medical procedures. You can imagine if there is a puncture, if there is something that opens the body and makes it accessible to microorganisms, then they can enter into the nervous system that way as well. Microorganisms can enter along the peripheral nerves, for example, from a rabid bite. They can also spread throughout the body if a microorganism enters into the bloodstream or to the lymph system. Remember, microorganisms that get into the bloodstream or the lymph system have the availability of the whole body, including the nervous system. There are many different types of microorganisms that can cause microbial diseases and infections within the nervous system. Bacteria can cause infections along with viruses, fungus, worms, amoebas. There's all kinds of things that if they can get into the nervous system can cause an infection. Microbes infecting the nervous tissue can cause infections like meningitis or encephalitis. Again, that blood-brain barrier helps to prevent the passage of many microorganisms. And we must remember that it can also prevent the passage of medications. Meningitis is inflammation of the meninges. If you haven't had A&P, the meninges are a continuous circuit of membranes that are around the brain and the spinal cord. Encephalitis, again, is inflammation of the brain specifically, not the meninges. This is an image that is showing the meninges around the brain. It also shows the cerebral spinal fluid. The cerebrospinal fluid, it provides a cushion for the brain. And when it's cultured, the cerebrospinal fluid, or CSF, should be clear. What happens if microorganisms get into the cerebrospinal fluid? They grow and they can increase inflammation, and that can increase pressure on the brain. In our class, we're going to focus on bacterial meningitis. There is a viral type of meningitis, but it is less severe and it is never treated with antibiotics because it is a virus. There are many types of bacteria that can cause meningitis. Some of the signs and symptoms are very similar to flu-like symptoms: a fever, a headache, stiff joints or stiff neck, nausea, vomiting. There's also things that can occur like limb pain. Your arms and legs can ache. You can have very pale skin. You can have cold hands and feet. You could have a sensitivity to bright lights. You might wonder why I don't have a rash listed on this slide. I'm going to talk about it later on, but I want to say that the rash is a very late sign. A macular rash is a late sign when the infection has become systemic. It is septic at this point, and you can die from a misdiagnosis of bacterial meningitis if you're sent away from the ER if you're only looking for a rash. You need to emphasize and look for these early signs and symptoms. You can have convulsions and coma as bacterial meningitis progresses. It is diagnosed by a gram stain of the cerebral spinal fluid. It's treated with cephalosporins. It has 100% mortality if not treated with antibiotics. For an infection to progress and have an estimated 100% mortality if not treated, this is a very serious infection. This is an image from your textbook showing Neisseria meningitis. Remember, we talked about Neisseria gonorrhea before. Well, this is Neisseria meningitis. And this is a really good image of what it looks like when it's stained with a gram stain. Neisseria meningitis is a very common cause of bacterial meningitis. Again, there will be an abrupt onset of this infection that will usually start with a very severe headache. It's because the Neisseria is replicating rapidly within the cerebral spinal fluid, causing inflammation and putting pressure on the tissues of the brain. You will have meningeal signs, mental changes. You will have confusion, depressed level of consciousness. Because this pressure is building, it can lead to these mental changes that occur. You will have a fever. Again, that rash is a late sign. You can't just look for the rash that occurs. Yes, there can be a macular rash, but we must look for these other signs and symptoms. What's really important to consider about Neisseria meningitis is how rapidly it can progress to sepsis of the body. And it can cause these cytotoxic effects when it causes sepsis. You can have ischemia, shock. You can have all kinds of different things occurring within the cartilage. You can have aches and pains because of the sepsis spreading throughout the body. And it can actually affect the chondrocytes, which make up your cartilage, causing these aches and pains. Again, we have to seek early treatment because mortality approaches 100% in untreated patients. Because this is a gram-negative bacteria, the endotoxin is what can cause this septic shock and hemorrhage within the body. As you know, that endotoxin is released often when the bacteria itself is killed by a particular treatment. When antibiotics are administered after culture of the cerebral spinal fluid, you try to use a treatment that will not release this endotoxin. However, If you need to use an antibiotic that will release the endotoxin, sometimes it's a necessity to help with the infection. You must be absolutely aware of the signs and symptoms of sepsis that we have talked about in the past. So there's less than 10% mortality in patients receiving prompt, appropriate therapy for this gram-negative bacteria. You have to be quick with the treatment. So you have to culture quickly. You must suspect quickly. The incidence of neurological sequelae is low, which means that if you are treated with antibiotics, you don't have many additional complications that can follow an infection of Neisseria meningitis. Sometimes you can have some hearing loss, and because this is affecting the chondrocytes and the cartilage, it can lead to some signs and symptoms of arthritis. Prevention of meningitis is with a vaccine. There are different types of vaccines that are used against meningitis. You can have a vaccination that is specific to children who are 11 to 12 years of age, and then they will need a booster when they are 16 years of age. There is a polysaccharide vaccine, which is a different type of vaccine to help prevent meningitis. Serogroup B meningococcal vaccine is recommended for those who are between the ages of 16 and 23 years of age and are at risk for meningitis. Oftentimes, universities or the military will administer vaccines to prevent meningitis. OSU and U of O oftentimes will require a meningitis vaccination if you live in the dorms. On campus, you're in close quarters and you are at risk of spreading meningitis. It is like a flu vaccine, so there are many different serotypes and strains of meningitis, and you must be diligent and get a vaccine that is recommended for what you are at risk for. Clostridium tetani can cause the infection tetanus to occur. Remember, it's a gram-positive endospore-forming obligate anaerobe. When I talk about treatment, remember that. So, what happens is these endospores can be in the dirt, they can contaminate soil, they can be on rusty equipment. And remember, if you get a wound and these endospores are able to get into that wound and find a really great environment for them to come back to life and replicate and infect you, you can be infected with tetanus. It causes a contracting of the muscles. The muscles are unable to relax. The toxin can get into the nervous system and it gets into the neuromuscular junctions. It affects the junctions. It can cause signs like lockjaw, where your jaw is open in a locked position. You're unable to close your mouth. It can be life-threatening because it can affect your diaphragm. Your diaphragm is a muscle. If tetanus infection is occurring and is infecting your diaphragm, you will not be able to breathe because you will not be able to contract and relax your diaphragm. Growth can occur in deep wounds following this infection. That's absolutely true. Vaccination is with a tetanus toxoid booster. This is a preventable infection. you will need to get this booster every 10 years. So this vaccine is good for you, and it can help prevent tetanus. If you get a very severe cut, oftentimes when you go to seek treatment from a healthcare provider, they will ask you, when was the last time you had a tetanus vaccination? And so, if you don't remember, they will give you a tetanus vaccination because this is such an effective vaccination and it can help prevent the infection tetanus. So again, when tetanus infection occurs, the tetanospasm is released from the dead cells, and it antagonizes that acetylcholine in the neuromuscular junction. And it will cause rigid contractions with an inability to relax the muscle. Rigid contractions. This is the stiff contractile state that can occur if you're infected with tetanus. Treatment is with tetanus immunoglobulin. If you didn't have a vaccine, or if you were somewhere where there was no vaccine available and you were infected with tetanus, you would need to be treated with tetanus immunoglobulin because this is life-threatening, because it can affect the ability of the diaphragm to work. It can contract, but it can't relax, so you would not be able to breathe. If you could also be treated, remember, because this is an obligate anaerobe, you could be treated with oxygen. The wound could have oxygen pumped into that deep wound. You can have hyperbaric treatment, hyperbaric therapy that can help to affect that obligate anaerobe from replicating and spreading throughout the body. This is an image showing that rigid, contracted state. This is pretty specific. This rigid body posture can occur once tetanus has spread throughout the body. Clostridium botulinum is a gram-positive endospore-forming obligate anaerobe. And again, this is an endospore-forming microorganism, and it's an obligate anaerobe. Infection is due to ingestion of the botulinum toxin. So ingestion can occur from improperly prepared foods, soil-contaminated foods. Improper home canning was often the cause of botulism. It causes flaccid paralysis and the inability to contract. You are only in a relaxed state. It blocks the release of acetylcholine at the neuromuscular junction. This botulinum toxin can turn off the ability to contract, and so you will be in a completely relaxed state. Again, this can be life-threatening if it affects the diaphragm. Treatment is with supportive care and an antitoxin. This antitoxin can stop the toxin from doing more damage, but it can't undo what is already done. So treatment must be started early so that the damage to the nervous system has not progressed. Prevention of botulism is through proper home canning procedures. You have to use the proper techniques when you are home canning, because the food can be contaminated with endospores and then they can germinate and come back to life if you do not properly can them. Nitrites are used in food preservation. We've talked about nitrites before. they can prevent endospore germination, and they are used in commercial canning or commercial treatment of different types of food, like meats. There are additional types of botulism. There is infant botulism. It can grow and multiply in the intestines. The endospores, again, are found in soil, or botulinum can be in water or in honey. Raw honey is not recommended for any child under the age of 2 by the CDC. A child needs to have a full immune system developed in order to be able to withstand this botulinum that may be in the honey. Wound botulism can grow in deep wounds. Now that sounds familiar. That sounds like tetanus. The difference between tetanus in a wound and wound botulism is that there is that flaccid paralysis that will occur, the inability to relax. If someone has a weeping wound that has clear fluid and they have the inability of the muscles to contract, that would be wound botulism. If they were in a contracted state, then that would be tetanus that has occurred in the wound. You have to look for that contraction, which would be tetanus, or flaccid paralysis, the inability to contract, which is wound botulism. Oftentimes, wound botulism will occur in IV drug users, those who use heroin. Some of the signs of wound botulism can actually look like an opioid overdose. An individual may have slurred speech, they may have that weakness in their muscles, they may have difficulty breathing because the botulinum is affecting the diaphragm. How you would tell the difference between an overdose and whether it was caused by a wound infection at their site would be that you would administer Narcan. If the Narcan was effective, then it was an overdose. If it does not do anything to alleviate these signs and symptoms, then they may have wound botulism and need to be immediately taken to a healthcare facility so that they can be treated. Again, this would be a wound that has a weeping seepage of clear fluid. And again, it's associated with that inability to contract. This is an image showing a child who's been infected with botulism, and you can see that floppiness, the inability of the body to contract. That is a clear sign of botulism. This shows that weepy, clear fluid that can occur in wound botulism. Remember, you need to look for the signs and symptoms. You need to look and see if they do have an inability to contract their muscles, if that absolute extreme weakness is occurring. Now again, this is also an anaerobe, just like tetanus is, and it is treated with the antitoxin. But again, you could treat this wound with oxygen. It grows deeply within the wound because it is an anaerobe. But if you treated it with oxygen and pushed the oxygen into it, you could have an effect on this botulism that is spreading. Leprosy is caused by the Mycobacterium leprae. It's a mycobacterium, so it is an acid-fast rod that has that mycolic acid in its cell wall that can resist disinfectants and it can resist antibiotic treatment. It grows best at 30 degrees Celsius. Now, leprosy is not an infection from days gone past. It's not from thousands of years ago. It is still occurring to this day. There are still infections of leprosy, especially in developing countries. The growth can occur in the peripheral nervous system and in the skin. So it can change the nervous sensitivity that's occurring in the skin. It can cause numbness. Transmission is through prolonged contact with an infected person from in-home caregivers who are not properly protected. This is not caused by casual contact. For many years, those who were infected with leprosy were shunned, and there was great stigma when you had leprosy. You were put in a leper colony and separated from the rest of those in your community. That should not occur because this is not caused from casual contact. It's caused from prolonged contact. Diagnosis is by a skin biopsy of the nodules that can sometimes form and a lepromin test. There are two types of leprosy that can occur. The tuberculoid form, which causes that loss of sensation in various skin areas where the nerves are being infected by that mycobacterium. It can also cause like this dispersed pigmented lesions that can occur. And it will have a positive lepromin test. This is very treatable in the early stages. Leprosy can progress, and it can progress very slowly and replicate for years. It can cause a lepromatous form that causes disfiguring nodules over the body. This is more severe. What's unique about this form is that it will have a negative lepromin test, but you culture those nodules to test for the mycobacterium. So a lepromin test is used to determine the type of the leprosy infection. A skin reaction will occur to the injected lepromatous tissue if it's positive. The image on the left shows that disfiguring nodule that can occur and cause necrosis as well as these nodules. It can occur all over the body. On the right, you can see that it is a gram-positive bacillus. And remember that mycobacterium that is acid-fast has that mycolic acid in its cell walls to help it resist the ability for disinfectants to penetrate as well as antibiotics. But it is treatable in the early stages. Without treatment, the mortality of bacterial meningitis from Neisseria meningitis is A, about 1%, B, about 10%, C, about 20%, D, about 100%. The answer is D. If Neisseria meningitis is not treated quickly with antibiotics, it approaches 100% mortality. Puncture wounds that result in muscle weakness are likely infected with A, tetanus, B, botulism, C, leprosy, D, meningitis. The answer is B, botulism. puncture wounds that result in muscle weakness are likely infected with botulism, like in wound botulism. Now, if it was a puncture wound that resulted in muscle contraction that had the inability to relax, that would be tetanus. But in this case, it's muscle weakness is associated with that deep puncture wound. So it's B, botulism. Which of the following would be a high risk factor for contracting leprosy? Respiratory droplets from a sick person. B, skin contact from a sick person while taking pulses or BP measurements. C, living with a sick person in home caregiving. The answer is C. You need to have prolonged contact with someone who is infected with leprosy. You need to be their in-home caregiver who is not using the proper protection to become infected with this leprosy. It is not caused from casual contact. It is not caused because you're their nurse and you're taking their pulse or their BP, and you're using PPE as well. But you're not going to be infected with leprosy unless you live with this person for a very prolonged period of time. You are their in-home caregiver, and perhaps you are not using the proper protective equipment. Rabies is a virus caused by the rhabdovirus. It is caused by animal bite transmission. It can also enter to the body through scratches or open wounds. If you're scratched by an animal, the viral infection can enter that way. The virus infects the skeletal muscles, then progresses very slowly to the brain cells through the nerves, causing brain inflammation. Because this progresses so slowly, there is a treatment for rabies that I will talk about. The virions of the rabies virus have a very characteristic bullet shape, which you can see on the image on the right. There are two types of rabies. There's paralytic rabies, where the animal may seem unaware of their surroundings. Their muscles become paralyzed. There is furious rabies, where the animals are very aggressive. They're highly excitable. It's an extreme type of aggression. They can attack out of nowhere. It would be a squirrel if you were walking down a hiking trail and it jumped on you and bit you. It's not a normal, ordinary type of behavior. It's an extreme change of behavior. Also, nocturnal animals may be out in the day. A couple years ago, we likely had a rabid raccoon that was in a tree near where we lived because it was always out in the day, and they are nocturnal animals that prefer to be out in the night. And it made these terrible noises, so we did feel that it was rabbit, and did have to have animal control come out and help us because the raccoon was so sick. These animals that have this furious rabies can appear to be in extreme pain. They may bite themselves, and when they bite themselves, they may break off their teeth. They may have frothy, bloody saliva because they have an inability to swallow. One of the signs of rabies, which I will talk about in the next slide, is called hydrophobia, which is a difficulty of swallowing, so they clench their throats. These signs and symptoms are for a very sick animal that has furious rabies. Initial symptoms of rabies can appear flu-like. You can have a headache. You can have a fever. You may have some discomfort at the animal bite site. As the symptoms progress, and they progress very slowly, they can cause muscle spasms of the mouth and throat, an increase in saliva, hydrophobia. Remember, I talked about hydrophobia on the previous slide. So when you see the word hydrophobia, you may think a fear of water. In this case, it means difficulty swallowing. And so it kind of relates back to that word. As rabies progresses, it can be fatal. Now, there is a pre-exposure prophylaxis of human diploid cells. There is a rabies vaccine that can be used pre-exposure if you are someone who works in a very high-risk field. There is a post-exposure treatment, which is very painful, and that includes the vaccine of the human diploid cells and immunoglobulin. Now, you must be treated before it reaches the brain. If it reaches the brain, it's too late. But if you have a bite that occurs on your leg, it has a long way to travel to reach your brain, and it progresses slowly. So you could be treated with the vaccine and immunoglobulin, which will stop the progression of the rabies infection. West Nile virus is caused by a mosquito vector. The mosquito carries the virus. It was first identified in 1937 in Uganda. It was first identified in the United States in 1999 in Central Park, New York. So you cannot think to yourself that West Nile virus does not occur in the United States. It does. And as our climate changes, more mosquitoes are migrating and living in the United States. The mosquito vector is very important. It must be eliminated so that the West Nile virus does not spread. Some people have appeared to be immune even though they are infected with the virus, or they may have very mild symptoms, which I'm going to talk about the symptoms on the next page. Risk factors are medically fragile people, the very old or the very young, as well as pregnant women. General symptoms of West Nile virus, again, are very flu-like initially. You can have abdominal cramps or diarrhea, fever, headache. All of these sound like the flu. So you have to keep an eye on the symptoms and see if they change. You can have a lack of appetite, myalgia, that's those muscle pains. You can have nausea, rash, sore throat, swollen lymph nodes, vomiting. All of these seem flu-like. The symptoms can last 3 to 6 days. If West Nile virus progresses throughout the body and throughout the nervous system, it can cause confusion, unconsciousness, stiff neck, and weakness. Now, if viremia, it just continues to replicate within the blood and within the CSF, rare complications can occur. You can have brain damage, you can have permanent muscle weakness, and it can be fatal. Poliomyelitis is a very serious infection that can occur from infection by the poliovirus. Transmission is through ingestion of contaminated food or water. It can also be transmitted through ingestion via the fecal oral route or direct contact. Initial symptoms could be a sore throat or nausea. But if viremia occurs, if it continues to replicate and spread throughout the body, it can enter the central nervous system, the brain, and the spinal cord and destroy the motor cells. Paralysis can occur, or you can have a loss of the ability to have coordinated muscle movement. The communication between the brain and the ability to control your muscles is lost. You may also have the inability to control your blood pressure, or if it progresses, your respiratory system will be affected by this. You may be put in an iron lung to control your breathing, to help you breathe. That was what they did many years ago when polio was more prevalent. Individuals would live their lives in an iron lung for the rest of their lives. I'm going to show you an image of that on one of the following slides. But polio can progress and it can cause paralysis in some individuals. There is no cure for polio. This is a virus. Supportive care is essential, and you must watch for the progression of those symptoms. Non-steroidal anti-inflammatories can be used to reduce the inflammation, pain, and to reduce pain. Physical therapy to keep those muscles moving and to reduce the progression to paralysis. An iron lung may be necessary after entry into the brainstem, into the cerebral, into the CNS, the central nervous system, into the brain and spinal cord, so that if paralysis was to occur and it did affect the brainstem, then you may ultimately end up in an iron lung. There is a way to prevent polio, and that is through vaccine. There are many different types of vaccines. We in the United States use an inactivated form of polio for our vaccine, and it has 3 different types of viruses that have been known to cause polio in it. In other developing countries where there's poor sanitation or poor sewage control, where there is a higher likelihood of ingesting contaminated food or water, their viruses actually include a live virus to increase the potential for prevention of polio in those specific countries. There has been tremendous effort on many organizations, including Bill Gates and the World Health Organization, to have worldwide distribution of polio vaccines, and it is approaching eradication in many countries. These are images of patients in iron lungs. They would have entire buildings filled with patients who were living in these iron lungs that helped to inflate the lungs and help to keep these patients alive. There's also the image of helping the little child to keep walking. Again, physical therapy is very important if polio occurs. Albert Sabin on the left and Jonas Salk on the right are two of the individuals who are most well known for the development of their vaccines to fight polio. Jonas Salk was a gentleman who wanted to distribute the polio vaccine for free. He wanted to prevent this horrible disease from occurring and having patients live out their lives in these iron lungs. It really affected him, and he wanted it to be free. His viewpoint was very unique, as you well know from watching the antibiotic resistance documentary. It is very difficult to develop vaccines because it is so costly and it takes so long, and companies do not want to develop these vaccines because they do not get a great monetary return from them. But Jonas Salk was different. He focused all of his research on developing these polio vaccines so that he could help millions and millions of people, and he wanted it to be done for free because he wanted to eradicate this horrible infection. Again, the Bill and Melinda Gates Foundation and the World Health Organization, with support from the CDC, have really focused on eradicating polio. But there are still countries where it is very difficult to provide the medication to those who are at high risk for developing polio. There may not be adequate storage facilities. There may not be adequate refrigeration. These are unstable countries with unstable governments where they have a very high mistrust of healthcare workers. So it's very difficult to get to the people who are living in these countries. So it has not been eradicated, but it is still a strong focus of the World Health Organization and the Bill and Melinda Gates Foundation. In recent years, there has been identified a polio-like infection, which they call acute flaccid myelitis. It is not polio. Those who have acute flaccid myelitis are always tested, and they test negative for polio. It is an enterovirus, again, that can be through ingestion, and it targets the spinal cord. It causes arm or leg weakness, a loss of muscle tone, and a loss of reflexes. Very similar to polio, so that's why it's been identified to be polio-like. Diagnosis comes often after a previous cold or a previous respiratory illness or fever. Those things often have accompanied this acute flaccid myelitis. Again, those who have been infected have tested negative for polio. It just has similar symptoms. 624 confirmed cases have been identified since August of 2014. Zika is our third mosquito vector infection that we have talked about. We've seen malaria and West Nile virus, and Zika is an additional mosquito vector, mosquito-borne viral disease. It was discovered in 1947 in the Zika forest of Uganda. That's why it's named the Zika virus. The most common symptoms include a fever, rash, joint pain, and a unique form of conjunctivitis which causes the whites of the eyes to turn red. Usually it's mild and it can last less than a week, but it has been associated with Guillain-Barré syndrome, which is an autoimmune disease which can affect the nervous system. Local U.S. transmission was reported in 2016. So like West Nile, Zika is also in the United States and has the ability to occur in our country. So we need to make sure that we prevent these types of infections from occurring by eliminating the places where mosquitoes can grow and thrive. Get rid of any standing water. I've talked about that before in Zika can cause babies to be born with birth defects. They can have what's called microencephaly. So they have small skulls that develop and their brains are small and compacted. They can be born blind or deaf or have developmental and physical delays. These types of things must be monitored for if a pregnant woman becomes infected with Zika, because it can breach the placental barrier and reach the baby to cause these birth defects. Again, Zika can infect and replicate in the placenta. It can pass to the baby from the mother who is infected with Zika. It can also breach that blood-brain barrier. Now, it can possibly do this because of that increase in inflammation that can occur from the Zika virus. If an increase in inflammation occurs in cells, there are sometimes these gaps that can develop big enough for the virus to squeak by and get into the brain and cause an increase in inflammation and an increase in pressure. The virus can also be present in body fluids, including urine and semen. So they have thought that it can also be transmitted from person to person through sexual contact. Again, that major complication can occur in infants with causing birth defects and that microcephaly that can occur, the reduced size in the skull and the brain. It can also progress to causing acute paralysis, because it is affecting the central nervous system. There is a vaccine in early clinical trials, but for most vaccine development, it takes many, many years and many clinical trials before it can be put on the market. I want to thank you for the opportunity to have you as a student in my class. It was truly an honor for you to take my microbiology class, and I wish that we have been able to spend time face to face and have on-campus labs and have that on-campus experience. But I hope that you will take away a lot of valuable information that can help you in your future careers and your future programs. Remember, hand washing reigns supreme. You can prevent so many different infections and diseases if you wash your hands for at least 20 seconds. Please refrigerate your leftovers. And I want to add to that, please cook your food thoroughly. Never, ever, ever treat a virus with antibiotics. Antibiotics are for bacteria. Remember, not all microbes are bad. We have a great number of microbes that are good for us, and they are part of our normal microbiome and our normal microvirome. They are good for us. They're trying to prevent those pathogenic microorganisms from attaching. Remember that competition is really important. So keep those normal microbiomes really healthy and eat really well and take good care of yourself. If you had been on campus and been able to take on-campus labs, you would have smelled some really bad smelling microorganisms. Unfortunately, that's always part of the on-campus labs. The room kind of stinks sometimes, especially in the summer. The unknown is not to be feared, and I include that especially for my on-campus students because we study at the end to try and figure out what an unknown type of bacteria is that you are given. And so many students are worried when they first receive their unknown bacteria. They're afraid they're not going to be able to figure out, they don't know what to do, and it's really a stressful thing at first. But then they realize that if they take just small steps at a time and do small experiments and tests at a time, they can figure out what the unknown is. So it's not to be feared. And you can do the same in life. Take small steps and keep working towards your goals and your dreams, and you'll get there. The unknown is not to be feared. It's going to be something that is going to be a very positive experience for you in life. Microbiology is awesome. I hope that you got that out of taking this class. Microorganisms are fascinating. They're evolving. Sometimes they can be a very serious thing, and we have all experienced that. But remember, there are many microorganisms that are good, and it is awesome. I was so excited to tell you how awesome microbiology is. I forgot to point out the cool streak art in the bottom right-hand corner. Make sure you go back and you look at that. That is the coolest streak art that I have seen. There is a contest put on by the American Society for Microbiology every year, and people from all over the world contribute this really cool streak art. Check out their website sometime if you get the chance to see all the art that is made with microorganisms that individuals grow on Petri plates. It's amazing. And this slide tells you all of the different types of bacteria that they use to develop that beautiful work of art called the Battle of Winter and Spring. Here's another example of streak art. My friend that I know made this streak plate art, and he used Pseudomonas, which we've talked about a lot. He's a friend of mine who studies bacteria growth in frozen vegetables, and his specialty is finding microorganisms in okra, of all things. But he loves to do streak plate art, and he did pretty well in a contest, the contest one year, and did this really cool the branches of the lungs, the bronchi and the bronchioles, and it turned out really cool. So I want to show it to you. But remember, bacteria and microorganisms are really cool. And this is a slide telling you about how he developed his streak plate art and what he used, just for your information. Again, thank you for taking microbiology, and I wish you much success in your future in entering to your programs and your careers. And if you ever need help with anything, please contact me, and I'm happy to help you with applications or figuring out different schools to go to or different types of continuing education programs that are out there. You can, once we're back on campus, you can find me in 1577 lots of times, or you'll be able to find me in the microbiology lab in 1702, and I hope to meet you one day. Take care of yourselves. I'll be thinking about you.